Many patients come to us in which a knee replacement surgery has been performed and patient is annoyed by unusual noise coming from the knee at a particular position. Most of the time this is caused by a particular problem that is called as a patellar clunk syndrome. A patellar clunk syndrome is a problem in which there is a nodule kind of a thing which develops on the superior pole of the patella and which causes a obstruction in the bending and extension of the knee, and usually at about 30 degrees to 40 degrees of flexion the patient hears a noise which is called as a clunk. So whenever the patient moves the knee past 30 to 40 degrees, he will hear a noise which can be accompanied by pain as well. This is a very common occurrence in some particular joint varieties, specifically those joints which are posterior stabilized joint. It is less commonly seen in CR knees. Posterior stabilized knee is one of the very commonly used knees in joint replacement surgery, and typically the designs such as IB2 and PFC sigma have a high chances of developing a patellar clunk syndrome. Now there are several technical factors that can lead to a patellar clunk syndrome. This can be due to a thin patella, a decreased patellar tendon length, a small femur, if there is an anterior positioning of the tibial tray, there is a small femoral component which is flexed, there is a thick plastic bearing, if there is an increased posterior condylar offset, all these things may lead to an increased incidence of a patellar clunk syndrome. Usually this problem arises after 12 months of the surgery. It can be a little earlier or it can be a little late in some patients, and usually it is kind of a fibrotic nodule. There are three types of patellar clunk which are described. The first one is a classical patellar clunk syndrome, in which there is a classical nodule that is formed on the superior pole of the patella. In the type 2, there is no nodule as such, but there is a hypertrophic synovial tissue. So there are fronts, a hypertrophic synovial fronts, it's a hypertrophic synovium, and it catches underneath the patella and the femoral notch. And type 3 is a presence of both a nodule along with a hypertrophic synovium. Now there are some technical modification that we can do to prevent this problem. Whenever we do a total knee replacement, we should take care that the patellar button is used on the most superior aspect of the patellar resected region. The synovium on the superior part of the patella is cleared completely, and we also use a bovie to actually burn that superior part of the patella. Also, there should be no over resection of the patella, and the largest patellar button should be used. You should avoid any kind of a overstuffing, and you should resect the lateral facet of the patella completely. So by and large, when we follow all these things, the chances of patellar clunk syndrome is reduced, but it is not zero. So in some cases a patient may have problem of patellar clunk syndrome. With this video, I want to emphasize that if you are having a problem of patellar clunk syndrome, don't panic, don't be afraid, don't feel sad, because a very successful treatment in form of arthroscopic surgery is now available. With this treatment modality, what we do is we insert an arthroscope into your knee joint and we resect all the hypertrophic tissue, be it a nodule or be it hypertrophic synovium, with our specialized motorized instrument, and then we use our radiofrequency device to char that portion so that it does not reoccur. So if you are facing problem regarding patellar clunk syndrome, you are feeling noises in your knee joint after a knee joint replacement, you have to be positive, because there is a treatment available in form of arthroscopic surgery which can relieve you of this problem. Now this is a very simple procedure. We usually take about half an hour. We go into your joint, we clean that whole area which is problematic, and we check also that the clunk is gone or not. Usually this procedure is around 90 to 95% sensitive, successful, and most of the patients are very happy with the results of this procedure. But as we all know that the origin of this patellar clunk syndrome is usually due to some technical issues, so there is about 5% recurrence rate of these kind of symptoms after any kind of arthroscopic surgery. So friends, I hope that I am able to explain you clearly the causes of noises coming out of the knee after a knee joint replacement. If you want any further information, you are most welcome to write on the comment box. We'll try to answer your question as much as possible. If you want to have an online consultation, you can contact us on the numbers given below. We can have an online consultation as well. Thanks a lot.